Okay, thanks everyone for coming. My name is Kathleen. I'm here on behalf of the Piscataway Public Library, and we have Shalu joining us today to present on lockdown impacts on on physical and mental health. Shalu is a practicing occupational therapist and has been for the last 30 years. Her career focus has always been on learning new skills, collaborating to improve therapeutic intervention delivery and outcome measures for effectiveness, and has also been on evidence-based treatments. She's worked with cancer populations, vestibular and concussion populations, on hand therapy, and with individuals and patients with neurological conditions. I'm going to let her take over now. As I said, if at any point you have any questions or concerns, please just let us know in the chat. Thanks.
Well, good afternoon, everybody. My name is Shalu Chaudhary. I'm an occupational therapist, and I welcome all of you to this talk. And I'm grateful to Piscataway Public Library to give me this opportunity to share my thoughts and also help with the community awareness for health promotions. So the topic of my talk today is the lockdown impacts on physical and mental health. And before I start, there's a disclaimer. So this presentation is for educational purposes only. And if you have any question, concern, let me just lower this. If you have any question, concern, just please refer to your medical health professionals. So the lockdown concern. So the reference we are talking in this, the presentation, the lockdown is, of course, the COVID-19 reference. As with most of us, I'm gonna admit somebody, as with most of us, like we wanted this COVID-19, this pandemic to get over yesterday, and we need to just like the life needs to come back to normal, but it's still there. And all of you probably would agree with me, like the beginning of last year, 2020, and like now we're in June of 2021, the life has changed. The people like who got affected with COVID, whether directly, whether they were sick with it, or they saw their family members going through it, or co-workers going through it, or who were fortunate not to get sick, but just the impact of it affected us in so many ways. This tested us, the whole thing like tested us physically, emotionally, and just like stress-wise in different ways. So, hoping this will go down or go away as things are improving. So the reference point is, from the start of the pandemic to now for this talk, and that how it impacted like with the health conditions and what can we do to make it better if they are not better already. So what we saw in the past is, or like what I saw and what I read about it in the past, in the medical journals, is like we saw people with the lower physical activities. And I'm not talking about people who are walking and who are doing stuff, but mostly our seniors, or mostly people like who were going out for work. Outdoor work was being affected, outdoor activities were being affected. So, and also the seniors who were just going out, mingling, like doing a lot of stuff, exercises. So the physical activity really got affected in the beginning and also in the middle. So depending on like what phase of pandemic we were in, it did affected that. Then the social life during the pandemic and after, like now as things are opening up. So we had to change the social life, like, from the beginning of it, when the lockdown happened, from not meeting anybody, social distancing, to like now where things are opening up. And this has added to the fear, to the anxiety, to the stress. So a lot of different things. This whole lockdown has impacted the sleep. There's a lot of sleep disturbances which are happening. And it's also adding on to the loneliness, loneliness of not meeting people. People were not able to meet their parents, their loved ones, or children, or, seniors who were living by themselves. They could not go out to the stores, or just could not socialize it. I worked in nursing homes and assisted livings, and it's just the plight of loneliness is like beyond something. I think that's just a pandemic by itself. So, there's a lot of loneliness which happened. And there was also like a change in the relationship we all had, or most of us had, with alcohol and with the food, whether it was a higher alcohol intake or a lower intake, or the diet, whether the nature of the diet or the choice of the diet, or the quality, the timings, it also affected it. And it affected the health in so many different ways. And we'll talk about that. And then the other shift which had happened during pandemic was the work from home. All of a sudden, I mean, there are professionals like the computer professionals which had some experience in working from home, whether in the hybrid model or they were just, working from home in a different site or remote working. But majority of us who had to switch it, they had no experience with it. So that work on home affected adversely on the posture, on the joints, on the nerves. And then we obviously were spending more time on the electronic devices, whether we're surfing on the phones a lot, or watching TV a lot, or just using the computer screens or tablets. It impacted our eyes. I was talking to Kathleen before we start, like, there was an increase viewership on like ebooks and stuff. So there's like a lot of those things where we use the electronic screen more than we had done before. So physical activity. I mean, again, this is the reference point is pretty big. It's a pretty big thing. And I'm not judging here. So maybe not, like maybe some of us got very active last year and some of us did not get that active, or there was a reason to get active. Maybe, people going out, or the people who were sick, who were by themselves, and especially seniors who were just, they got confined in their houses, or in like assisted living, or any places where they were by themselves, or senior housings, because they were not allowed to go out, or they were told for safety reasons, for COVID reasons, don't go out. Like the doctors were, like they were telehealth, the teledoctors, if the grocery was being delivered, there was nobody coming and going. So the physical activity got like really affected. And we still see the lingering effects of those physical activity changes. And this, I see it in the clinic. So if you know of somebody whose physical activity got affected, please encourage them to start walking. If anything, just start walking. The weather is changing. There's nicer now. Get some vitamin D, just get some fresh air and get a change of perspective, change of scenery, and just start walking. In the house, in the neighborhood, in the parks, just do that. Do some home exercise program. If somebody had an exercise program which they were doing before, whether a professional had given them, like a therapy professional, or a personal trainer had given them, or just they just had one their own, just start doing that. Or just, reevaluating where we are in the terms of those exercises. Get some personal training. The supervised group exercises are also opening up, whether in the private personal training sessions or in the community-based gyms. Like a lot of the supervised exercises are opening up. A lot of those exercises are still virtual, but at least it's done by, is a controlled environment, and it's done by somebody who has vast knowledge of it. So do that. If you feel that either you or your loved one got affected with their physical activity and they're not as active as they should be, especially our parents, our grandparents, our uncle, aunts, or our older relatives, make sure you call the doctor and get these people started with some physical and occupational therapy, and then just help them increase their activity levels so they can function better. I would strongly suggest to avoid relying on the social media based exercises. I'm not against any of this influence, and I'm not opposed to that, but I feel like there has been a lot of, like, there's a Google University, there's a YouTube University, and then there's lots of us are doing WhatsApp. There's a WhatsApp University. So there's like, everybody's an influencer, and there's a lot of people putting out videos, which who knows, what's their background is, what's the information, and it's not one size fit all. So you really want to customize it if you have not started the physical activity as much, or if you had not gone to the gym for a while and you're still not too sure, what can I do, what can I not do? So go to the doctor, get some help there, and get some therapy started. Social life, as I said, like, we're all social beings. We're used to going to theaters, going to schools, meeting our friends, just playing outside, going outdoor stuff. And then all of a sudden we were confined, confined in that, whether we were confined in the house, in our environment, or just confined within ourselves. I think that was even worse because, we were not meeting anybody besides our people who we were cohabitating. There was a fear of, like you're going out to the grocery stores, there were signs for social distancing. There was fear like who has the disease, who doesn't have the disease, is it clean, is it not clean? And now as things are opening up, should I mask, should I not mask? I mean, is it vaccine? This person is vaccinated next to me or not vaccinated? So there's a lot of like to be, not to be questions, and it's impacting us. It's really impacting us. So then a lot of things I just mentioned, like the social distancing. But one thing I think this pandemic has done, at least for me, it gave me an opportunity and it helped me increase my awareness of, what are my meaningful relationships in life? Like what are things which are more important to me? What things are giving me happiness? What things makes me sad? So maybe if we can just take an account of that and then just increasing our awareness and try to do those things which help us grow and also go back to the social life as things are opening up, just like trending back a little bit, because whether we like it or not, the schools are opening up, the offices are opening up, the hybrid model is there, but then maybe the full-fledged is coming up in fall. Or the grocery stores, like they are not going to be social distancing, or the departmental stores. So, things are going to get busy and it's going to be a challenge for all of us. In the beginning, it was a challenge when we had to stop meeting people and stop going to these stores or outdoor activities. And now it's another challenge of like, how do I restart? How do I prepare myself that I'm going to be safe to do it? But, it's going to happen because the numbers are going down. It's going to happen. It's just like we just have to start prepping ourselves to do that. So there's a lot of social anxiety of things opening up, but then on the flip side, there's a joy of meeting people. So there's like a push and pull kind of situation, and which most of us are experiencing that. So nobody is alone. And I said, the stress impact. So the stress of whether it's the physical activity or the social activity, or just like the stress of like whether I had to do like work from home, or how do I manage my health condition? How do I go to the doctors? That impacts. And I don't think anybody can live stress-free. I think it's a far-fetched statement like, oh, live a stress-free life. I don't think it's possible. At least I don't believe that. But however, a little bit stress is needed. I think some little stress acts as a catalyst in our life, and it helps us to go through it. But when the stress becomes chronic, it starts impacting us. It starts impacting us in physical ways and in mental ways, which we don't even know that, oh, this is a reaction of a chronic stress. So it weakens our immune systems, makes us more susceptible to any viruses or any diseases, anything which is around us. It impairs our sleep. It changes our food pattern. And, then of course, like the weight gain, weight loss comes with it. If we're not sleeping well, if we're not eating well, if we're not doing enough physical activity, the weight's going to fluctuate. And that adds more stress, body image, and all the other factors. And it can also manifest physical symptoms like aches and pains and swellings and dizziness, and also in some cases, tremors. So, it's a very wild animal which needs to be tamed at some point, if possible. The stress is also impacting now that as things are opening up, like how to socialize again, how to meet people. Should I give somebody a hug or should I not? That kind of thing. So, like take an account of it, like, be a little bit more aware and reach out for help. Do not hesitate to reach out for mental health issues and seek mental health providers. If the stress has impacted physically and there's a physical elements which seems to appear to have worsened, just reach out to the doctors and get started with them PTOT and then see what we can do. But in the meantime, keep doing what you're doing, increase your physical activity, focus on hobbies, do some journaling, do some like mindful practices like meditation and yoga if you're a fan of that. Spirituality also helps with the stress, so whatever your faith belief is, just follow that. A lot of the house of worships are opening up, so I think it's also giving a lot of people opportunity to just get out. Now sleep, we all know that, like, oh, if I had like that good night's sleep, man, does that feel like I won like $1 million. And and some of us have some medical conditions, or, we're in that age bracket stuff where we're getting up at night, like routinely, like 2 or 3 times a night, to go to the bathroom or to drink water. I mean, that was our normal pattern. But when this whole shift change like happened, like pandemic, a lot of like us, like the schools were closed, the offices were closed, there was like nothing to do. So we were watching TV, or somebody did like work from home, and they're always, so at the end of the day, they're like, I'm just gonna go to the couch and just like, just lay down, or I don't have any place else to go, so I'm gonna go to one room and then do that. And these are the stories I heard from my patients, so that's how I know it. But it definitely changed it. The sleeping habits changed, sleeping pattern changed. Where we were sleeping, taking naps were also changing. So to help with that, what we call is like a sleep hygiene. So, you know, make sure that we are disciplined. We're disciplined to get 7 to 8 hours of sleep, like have a set bedtime and a wake up time and stick to it. And I understand, the medical professionals, the people who work overnight, the retail workers, they all have a very erratic sleep patterns depending on the shift workers, like the shift workers, depending on like what the sleep patterns were before pandemic. Those are, understandable things, but in general public, we all had a routine time. So just stick to it. If it's helpful, then maybe use a sleep tracker and see if that helps. I saw it in my own household. My husband is a very light sleeper, and he always had trouble sleeping at night because he's a shift worker, and he had very different shifts. But then he got a smartwatch, and then he started wearing the watch at night and started tracking the sleep. Whether I wanted him to have an electronic device on his watch on his wrist at night, that's a different story. But what it helped it, that he can monitor it. Oh, I slept 4 hours. I slept 5 hours, but now he's making a consistent change in his own habit, that he's, making sure that he's sleeping like 5 to 6 hours, at least peaceful sleep before he gets up, or even more, on his days off and stuff. So I think it can help in so many different ways. People like to it's helpful to have maybe the dark room, maybe like have a little less light in the house, use darker curtains. Some like the white noise, like with the fan, or just like a white noise app, or in the background something is going on that do that. Another suggestion I has is to avoid the use of the phones or any electronic devices during bedtime or in the bedroom if possible. Maybe 30 minutes, 45 minutes before your bedtime, try to do something which is a relaxing activity. Some people find it meditation relaxing. Some people find it like some form of a breathing practice is helpful. Even people who experience some aches and pains, maybe a light stretches helps, because then it helps them to ease off in the bed. So whether your sleep got affected during pandemic or it was before, just try these things and see some of these activity modifications and see if that makes a difference. And if nothing helps, then go see a sleep specialist, sleep doctor, and just make sure that that you don't need some medical intervention. Work from home or virtual school. I have a lot of respect for people who did work from home even before, but then the people who had to switch it, at the blink of the eye, as I said, the drop of the head, is the teachers, the librarians, or the doctors, or like the healthcare professionals, which had to switch it and like no idea. I think the people who were already working in a hybrid model, they had some form of like a computer station set up and they were used to it. But a lot of them was this cartoon, I really liked it, like I'm out of bed and I made it to the keyboard, what more you want? You hear the stories like, they have kids at home, they have their parents at home or their spouses at home. So they're just sitting and doing work because the work needs to be done, with the kids around, or just kids are screaming, or they're sitting on the bed, they're sitting on bar stools. I have, like when you take an account for the patients who get to the clinic, some of them are sitting on the floor, or they have the laptop in their lap. So there's a lot of like different ways people got affected. And even the children who were attending the school or colleges, that virtual school, all of a sudden it was a challenge. It was a challenge to to have a switch, and a challenge physically because our workstations were not designed, and and the places were not open to get the right stuff. So everybody had to do a makeshift. So this truth versus reality, like this is like the ideal, of course, like you're sitting in the ideal position, the most ergonomic positions where your eyes are at the computer monitor, your wrists are straight, the monitor is like the island, you're sitting correctly, your neck back, your lumbar back support, your feet are rested. But so who knows, this is the truth or this is the truth where, and I also found this cartoon, which was also very cute, at least for me, that, when we were working at the office, we're always dreaming, oh my God, I wish I could just take a nap at this point, or what would be nice, like just to go home. And then we're working from home, we're like, oh God, can I just get away? Can I just go out somewhere and then, go to work? So, we're never happy any place, but, it's just, again, I think it's in a certain change from like going to the office to work from home affected people. So these are just like two examples of the workstation, whether we had the standing table or whether we had the sitting arrangement where things are placed ergonomically. If you had not had that, make sure you contact the doctors or therapists. There are people who actually specialize with ergonomic assessments. Most of the workplaces, they should have somebody in the HR who's helping you do that, and then get that help because your body is very important, and we're working for 8 to 10 hours a day. So to make sure that it's it's staying as healthy as possible. Now, the next topic I want to talk about is like the digital eye strain. Now, digital eye strain is not new. I think it just got aggravated in the pandemic area with the excessive use or with the extra use of the electronic devices. I'm not too sure if anybody's familiar with the term like computer vision syndrome. This has been widely used for the last few years as the things were becoming more electronic, and the computer screens and the electronic screens were becoming more and more thing. The textbooks were going electronic, the reading books were going electronic. So, there's a lot more electronic use. And as far as the eyes are concerned, like most of us think like eyes is just used for seeing, we want to see up close, we want to see far. That's what eyes do. But eyes have other function too besides that. Eyes are, as we say, like eyes are the windows of the world. It affects our memory, it affects our concentration. We use this term in medical term, is called visual information processing. What that means is our brain processing information, what is presented to us in our visual field, whether it's here, whether it's here, whether it's here. So whatever information is processed whatever information we have in the environment gets processed, but the window is through the eyes. Now, our electronic screens, whichever way it is, whether it's your watch, whether it's your computer screen, your phone, your electronic, like Kindle or iPad or any of those tablets things, the screens are moving pixels. So the eyes have to work extra hard to fixate a gaze. So when we're reading a book, the words are stationary. So you're just like reading it. But on the computer, it's a constant moving, which we don't realize. It's a very small, like a very, very micro movement, but the eyes have to work very hard to stabilize the gaze against that moving object. So there's already a strain, and this pandemic had added more. So how did it impact us? It impacts like the people get blurry vision, and then there's a focus which is getting in and out. Or in some cases, some patients even experience like double vision. A lot of us, like, especially students or teachers, where they have the notebook, they're looking at it, they're looking at the monitor, or they're taking notes, or they're writing something back and forth, up and down. That accommodation for far and close, because the eyes have to team up to do this, and then it go out to look at the screen, and then come back to do this. So that accommodation was getting affected, and it does get affected. It also adds to the headaches and can cause some neck pains and back pains. It can cause some heaviness. In some cases, I haven't seen it causes like vertigo-like symptoms and dizziness. So there's a lot more to the eyes, what we see, not just like acuity. It does a little bit more on it, and then using the electronic screens doesn't help. But what can we do to help? So very important to keep our eyes healthy. if you use corrective glasses, I would suggest, keep using them. Do not just get the readers and just try it out. Just go to the doctor. And if you have not gone to an eye doctor in the last year, please go make sure that you see an ophthalmologist, an optometrist, and get comprehensive eye examination. Just make sure it's not that they're checking your eye health, they're checking the acuity, and then they're also checking the dynamic function. What it means is like two eyes have to work together in order to function. So, because that would affect our ability to see, that would affect our ability to concentrate, to have attention to the task. So it has multitude of effects. So please do that. In the meantime, as you're setting up appointment, you control the glare on the screen, whether you go to the settings of your devices and adjust the glare, maybe use the light and dark mode. There are screens which you can get it for all kind of devices. So use those screens, help protect your eyes. Use of blue light glasses. They're easily available in the departmental stores or online, whichever portal it is. Order some blue light glasses if you're continuously using, or if your work required use of a tablet, laptop, or a desktop. The other thing, when I have patients who have eye strain and I see them in the clinic, I usually share with them there's like a 20-20 rule. What that means is like if you're done at 20 minutes of activity, allow yourself 20 seconds to either do some kind of eye rest. So whether you can just close your eyes or blink your eyes, that is helpful. Sometimes cupping or palming, where you just like rub your eyes, generate some heat, and then put it on top of your eyes. That's it, maybe a few times. That helps. It just like soothes your eyes and just like help calm the nerves. That's very helpful. Or just getting up and washing the eyes with cold water. If there's a break or maybe end of the day, you can keep an eye gel pack, maybe a cold eye gel pack or cucumber patches, whatever helps, but just do something which would help to soothe the eyes, okay? Or go to the doctor. Now, health issues, whether new or existing. As I said, when the things closed, a lot of us did not go to the doctor, or the doctor's offices were not open, or we were just like afraid of going out. A lot of the long-term issues, got neglected. And during the peak, especially during the peak pandemic, it had added to the falls, whether it's inside the house or outside the house, and not seeking timely help. I saw a few patients who fell either like middle of last year or like toward the beginning of this year, but they still did not go to the doctor or the healthcare provider in the timely manner. So, and then that thing just like added to it, whether it was like they were afraid to go out, or they just did not, or there was nobody to drive them there. There were many factors, but it just added on to the trauma of that, and the fear of falling again. The balance was getting affected, and just like the physical ailments. The work from home or the postural changes or the physical activity, sleep pattern changes added to the stiffness of the joints and muscles. And, there's a lot of increase in the neck pain and the back pain issues. There's an increasing episodes of tingling, numbness, dropping things from the hand. Especially when we're working a lot on the computer, it's like impacting our nerves, which are coming from the neck, going under the collarbone and affecting our hands or the arms. So there's a lot of risk of carpal tunnel, thoracic outlet, which is, you get it here, sciatica, which is in the back pain because we're just sitting and that nerve get affected all the time. So it's very important that we take a break every 20 minutes or 15, 30 minutes, whatever it's being allowed in your situation and circumstances, but just do take a frequent break. The other thing which I also saw, and I saw a lot of patients, and it's for the vertigo, and I called it like lockdown vertigo. I don't think it's a medical term, lockdown medical. It's not. But I saw patients who came in, and whether they were fearful of, what's going on with the virus, whether it's the environment is clean, not clean, how many PPEs should I be wearing, or they were working from home, or something else happened that these people had just gotten into this mode. I saw patients who were literally just coming to me like this. Their eyes were barely moving from like one end to the other, and they were dizzy, they had vertigo-like symptoms, they had headaches, they had vision changes in the eyes, and it's all related to the stress. It's all related to the physical and sleep patterns and stuff. So, that can also impact. It's not that like the patient had it and they're not having it. I think any changes in your health, whether it's an existing pattern or there is a new thing on top of an old thing, or a new kind of change which had happened to an old existing, maybe somebody had arthritis and it's just like flaring up and it's not calming down, just make sure you go see the doctor. Okay. And the poor diet and alcohol changes also affected the health. So consult your doctor. Consult your doctor. If you have not gone to the doctor, just make sure you see the doctor and go for your physical. Um, I'm sorry, I'm not doing a pitch for PTOT, but if you feel that these things are affecting physically, just make sure then you get a professional, a personalized consultation and have them develop a plan of care for you. Again, please avoid unreliable sources of information from online. If anybody's not reliable, don't follow that influencer. I hope there's no influencer on the talk right now. And I want to just share this beautiful quote from monk Thich Nhat Hanh, that because you are alive, everything is possible. And I think, is just a very collective statement. I said like the lockdown impacted us in so many ways. We saw the loss of life. We saw the loss of loved ones, whether directly, indirectly. And I don't think anybody has been spared from this loss, our loss of freedom, our loss of just like doing what we want to do, how we want to spend time with ourselves and with our loved ones. But, so far we made it through it, and I think collectively we'll go through it. We just have to make sure we all do our part, of the social responsibility, but then also responsibility to ourselves to help ourselves to get over this. So if you are watching any of these signs, if you become a little bit more aware of yourself, and if you're watching those signs within yourself or in your body, just reach out. Or if you see that you've seen it with somebody else, just reach out. Okay. And this is my contact information. I do work in Piscataway, so if somebody wants to reach out, that's my clinic information. But I also have my email. Please feel free to shoot me an email if there's any question, concern. And this is where I'll end it, but I will also open it for the audience. If somebody has any questions, I'll welcome that.
Great, thank you for your presentation. It looks like we've got a clapping hands here. I'm going to ask people to unmute. So you've got a couple people clapping for you, so that's good. I'll ask them to unmute. We'll see if they have any questions.
Shalu, it's Joseph. I actually observe at the outpatient clinic that Shalu works at. I have a question. I know you spoke in regard to loss of postural integrity throughout the duration of the pandemic. What would you say are a couple of exercises somebody can implement, or maybe in ergonomics tip that somebody can implement to increase or stabilize their posture?
Well, one thing I'm going to say, Joe, is like, it's hard to do a cookie cutter approach for exercises, especially if somebody's like really getting affected and I've not seen them. So I think exercise is a little far-fetched. Maybe they need to come in for a consult. But as far as ergonomic is concerned, I think just the basic is like, when you're sitting, make sure you're sitting separate. If you're sitting for a long period of time, don't sit like the way I'm sitting on a couch. It should be well supported. Your back, your lumbar support should be supported. Maybe feet resting on a footrest. The computer monitor should be at the eye length, so you're not constantly bending down. The wrist should be straight, so avoid any kind of, a future carpal tunnel. And arms well supported. So there's a whole ergonomic assessment, and I can share with you if you want to, shoot me an email. I can share with you a picture of that. for that. But, as far as exercises, I think just like general mobility, just like general giving somebody that, like the break, if you're on the computer for like long period of time, every 20 to 30 minutes, just getting up, just like even getting up and then just like stretching back and forth is helpful. Moving the neck is helpful, moving the back is helpful. And none of these exercises should hurt. So if it's hurting, then something is not right. And that's when you want to, seek some professional help.
Thank
I
you.
hope I answered that.
That was great. Thank you. Does anyone else have any questions that they wanted to ask? Feel free to unmute yourself. If you're having trouble unmuting yourself, you can also put them in the chat and I'd be happy to read them out. Bianca says she really likes your sleep hygiene recommendations because she knows how much sleep has been a big influence and impact on their mood and our overall health.
Thank you, Bianca.
All right, if we have no further questions, I think we'll wrap things up. Give people just 1 minute more to volunteer if they have any questions they want to ask or anything like that. And I want to thank you again, Shalu, for sharing your expertise. Oh, we do have a hand raised. Let's see.
Hi. I was wondering, because there's been a lot of emphasis about the importance of taking care of yourself during the pandemic, both mentally and physically. Do you think that mindset would continue after the pandemic is over? Sorry, it's a little...
I sure hope so. I sure hope so that, the awareness continues, that it's not just like, we don't need the pandemic to bring more attention to ourselves. I mean, and not in a healthy way, like the world should not revolve around us, but at the same time, we're the world too, I feel. So I'm hoping that this continues, I'm hoping that this continues. It brings a reflection on, what's important, what's not important, a little bit more mindfulness during our day-to-day activities. So I'm hoping, fingers crossed.
We have a question in the chat from Jerry asking if a recording will be available. Yes, a recording will be made available. The library will post it to our YouTube page. And we'll also make sure to send it to everyone who registered for today's session. Oh,
Can
we've
you
got a
hear
couple
me?
more. Yes. Hi, Barbara.
Hi. Wealth of information. I do have one question, and that is getting, I'm a senior, obviously, to get back into the community safely. And being shut down for a year, it's made it very difficult to make that first step out. What would you suggest?
I think, you're right, Barbara, being shut down for like a year, and it's actually a year and a half going. And
Yeah.
it's just that social anxiety. I think we just have to be responsible for it. And things are opening up slowly. I know in the township, like the library is opening up, or in person it has opened up. Maybe just going to safe places like a library would be helpful, just so that there's a confidence which is going out from the house to a place where we have some people. I mean, I know a lot of us have been going to the grocery stores or to the doctor's offices, but just like going to a community place would be helpful. And I'm hoping that in due time, the senior centers would open up, which is also a pretty, it's a safe place. But I think like if it's like one step at a time, if there's a park nearby, you can go to a park and you feel safe about it, just go to the park depending, on the situation. If not, then just at least go to the library in person and just, maybe sit there, read a book. Kathy, I'm not too sure. Like, is it like a time frame where the patrons can come in the library?
So the library is currently open to the public. We're open 12 to 8, Monday through Wednesday, 12 to 4, Thursday through Saturday. We do have individual seating So you're welcome to come in, grab a book and sit down. At this time, we don't have any group seating, so we're not encouraging congregating yet.
I don't want to sound foolish, but is this the one on Hose Lane?
Both of the Piscataway Public Library buildings are open. So the one on Hose Lane and the one facing Stelton are both open.
And what was that second one?
Westergaard Library, it faces Stelton Road. It's right across the street from the Quick Check next to Buzzy's.
Okay.
Yep.
Okay.
You know where they
Thank you.
have, Barbara, where they have a nice big, like a time clock kind of thing on the street. That's the library. Yes, it's like, it looks like a little, like a square, town square kind of thing.
Can I also add something?
Yes, please.
When you were telling the gentleman about the exercising,
Uh-huh.
in my offices, when I worked, I had 10 of them,
Uh-huh.
and all we did was key. They stopped every 45 minutes, exercised, rolled their eyes, did things with their shoulders, did things with their arms and hands. And
Wow.
I never had a carpal tunnel claim except for me.
Barbara, you ran a good office, and I think that's like the ideal office where there's a structure that, it's been, an option has been given to the employees, like, every 45 minutes, there's like a set number of exercises. So I think it's a great thing.
But it worked.
Thank you. That's a
It
really,
worked.
yeah.
Yeah. Okay, I'll leave you alone now.
Thank you for your questions, Barbara.
You're welcome.
Anyone else? Give it just another minute. Sometimes it can be tricky to figure out how to unmute yourself.
Do I need to unmute myself?
No, you're good to go.
Okay.
Joseph adds in the chat that movement is truly medicine.
I want to thank you for having this.
We're so glad you've enjoyed it.
I did.
Is this your first event that you're coming
Yes,
to from?
ma'am.
Oh, wonderful. Well, we're glad to hear that too. All right. In the absence of any other questions, I think we'll wrap things up. I want to thank everyone for coming. And of course, we want to thank Shalou for presenting and sharing her expertise today.
Well, thank you, everybody, and then thank you for your attention and your audience. And again, I invite all of you to reach out to the library or to me personally. And if there's any question, concern, or even suggestions for any, anything which I missed or maybe added differently, or any other topic you would like us to cover. Thank you again. Have a blessed day.
Absolutely. If you're
Thank you.
curious about how to get in contact with anyone, you can always reach out to the library. There's lots of contact information on our website. And you can always email library@piscatawaylibrary.org. That should be the easiest one to remember. Thank
All
you
right,
again.
thank you.
Have a good afternoon. Bye-bye.
Take care. Bye-bye.
Bye.